Good morning, everyone. I have 9 o'clock, so I think it's time to get started. Thank you for attending on this kind of cloudy, dreary day, at least where I'm at. It looks like where everybody else is at as well. So good morning. It's May 12th for those of you keeping track. Happy belated Mother's Day. I remember my kids when they were little saying, when's it going to be Kids Day? And I'd say every day is Kids Day. So bless all you mothers out there for doing the work that you do on top of everything else during this unprecedented time. So thank you for attending Telemedicine Echo. The Heartland Telehealth Resource Center, in cooperation with Missouri Telehealth Network, is bringing you this Telemedicine Echo for providers in Missouri, Oklahoma, and Kansas. And we will address topics such as technology, operations, clinical, legal, regulatory. We'll talk about some evaluation, but we want to let you know that we are condensing our telemedicine echoes. We've been holding them on Tuesday at this point, and then Wednesday at 2 in the afternoon. And we're going to take the Wednesday one and combine it with the Tuesday. So we'll only have one telemedicine echo from now on until we decide that we have, exhausted all of our speakers. So from now on, Tuesday at 9 will be our telemedicine echo. I know some of you have joined both, and we thank you for that. But we've decided that we're just going to put all of our efforts into one a week. I'm Janine Gracie, Project Director of the HTRC, and I have the privilege to moderate these sessions. I want to give a shout out to all of you out there still working on the front lines, and know that we're behind you, and we want to be of assistance and help you to the best of our ability in getting you involved with telemedicine. Before we get started, I would like to ask everyone to rename your echo screen. And so to do that, you just right click on your picture or your name, give us your first and your last name, and also your state. So right click on your picture, on your name, and we'll see something that says rename. Put your name and your state in there. We like to have the state in there so that we can see who's joining and also be able to answer questions appropriately. All right, now we will have the Hub team members introduce themselves. Let's see here. Is Karen on?
I am. Thanks.
Yes.
Welcome, everybody. I'm Karen Edison, the Senior Medical Director for the Missouri Telehealth Network and Show Me Echo.
Great. Thank you so much, Karen. Evelyn.
Good morning. Nice to see everybody on screen this morning. I'm Evelyn Nelson. I'm a telepsychologist at the University of Kansas Medical Center and the PI for the Heartland Telehealth Resource Center.
Thank you, Evelyn. Rachel, please introduce yourself.
Good morning, everybody. I'm Rachel Mutra with the Missouri Telehealth Network, Show Me Echo program, and Heartland Telehealth Resource Center. Welcome.
Next, Robert.
Hi, I'm Robert Stiles with the University of Kansas School of Medicine and Department of Pediatrics, and I also support the Heartland Telehealth Resource Center.
Excellent. Thank you so much. Tim.
Good morning. Tim Davis, Telehealth Manager at Oklahoma State University Center for Health Sciences in Tulsa, and the Oklahoma representative for HTRC.
Thank you, Tim. And last but not least, Heather.
Good morning, everyone. My name is Heather Hagan. I'm a telehealth analyst at OSU CHS.
Wonderful. Thank you so much. Okay, I'm looking to see if anybody has joined us by phone. It doesn't look like it. Okay, because we usually have to have them introduce themselves over the phone. But because we have more than 30, we just hit 41. It takes too much time to introduce everyone. So what we would like for you to do is make sure that you introduce yourself into the chat. So put your name, your title, your organization, and the state that you're from in that chat to introduce yourself. So please take a few minutes to do that. And as we get started, a few more little pointers about our echo. You know, just for a more collegial environment, we'll continue to use first names. Please be conscious of any confidential or protected health information. We don't get into that too much here during the telemed echo, but just in case. Ask Joe Kingsbury. If you will look at the chat, and down where you would type something in, you'll see a little arrow, and you can look for Ask Joe Kingsbury. This is where you can type in your questions if you have questions for our presenter as we go along, or if you have questions about the echo in general. So please use Ask Joe Kingsbury. And then those of you who are just not so shy, you can ask your question on live video after the presentation as well. So we want you to do that. During the echo, we will ask that you keep your microphone on mute until you're ready to speak. We don't want any disasters like what happened at the Supreme Court last week. And then also raise your hand so that we can recognize you, and then you can unmute your microphone to ask that question. Please give us your name before you ask that question too, so we can get to know you. Presentations and any case studies that we receive will be on Box, and the value of echo is in case studies. So if you would ever like to present a case study on anything about telemed so that we can discuss and learn from each other, that would be fantastic. All right, now to the didactic. Today we have the privilege of listening to Nathan Suter, who is going to provide us with a teledentistry presentation in response to COVID-19 with some telehealth regulation information. So Nathan, I'm going to let you take this away and provide us some great information.
Nathan, I think you're there.
There we go.
Cool. There we go. I am a general dentist near St. Louis, and I facilitated echo for oral health in Missouri, and so been doing teledentistry for a while, and I've been teaching dentists around the country in the last few weeks how to do teledentistry. So I'm going to get into some use cases, and I know a lot of people here are primary care providers, it seems like. So if you got any questions, feel free to, specific questions, you can email me or send them to Joe there. We can talk about them. But I'm a general dentist, and I do teach people teledentistry through my consulting company. This is a little bit of my background. I went to UMKC, worked at a health center for 6 years. I now have a private practice, and then do the teaching part of it. So dentistry, I read a really good article recently with some epidemiologists on there that were talking about how do we continue is the question. And so in the good old days of dentistry, it looked like that picture on the left. And in the article, the epidemiologist said, the next 3 to 9 months, it's going to look more like this milkman going to work amidst the rubble of London after the Blitz. So I thought that was interesting because the guy in the white coat could be a doctor. It doesn't take much to imagine that. But this is how dentistry is probably going to look like. So if you have patients going to the dentist, you're referring them to the dentist, they're going to be wearing a lot more PPE. New regulations are out, and we are anxiously waiting for any other further guidance on how we can protect our patients and our staff in delivering dental care. But it's going to look more like this. Lots of PPE, as long as you can find it. Another thing to think about that I've been telling people about is that there's been a lot of surveys going out, and I follow this company called Morning Consult, and they send out they've been asking people how likely are they to get into doing the things that they want to do again. And so this doesn't specifically talk about dentistry, but it kind of points a good lens that almost every single case here, they think that we're going to be allowed to do something before we're going to be able to be comfortable doing it again. And so I find that really interesting, especially dentists. They're really eager to get back to work and get back to seeing people, but it's up in the air whether or not people are going to want to come in. And so that plays into teledentistry a little bit, whether they feel safe or not. So there's been a lot of interest in teledentistry around the country. It's like shot up in awareness, both by the dentist and by the patient. And recently the ADA did a study, and 1 in 4 dentists around the country they survey 6,000 or over 6,000 dentists every other week around COVID, and 1 in 4 dentists are doing teledentistry to triage their patients. Okay, and so this is and it shows you by specialty. And if you're a solo doctor, you're less likely to do it. If you're in a large group, you're more likely. The pediatric dentists and the orthodontists and the oral surgeons are the earlier adopters. And so that's really interesting information as you guys are referring your patients. And I'm just going to take the assumption that you just kind of want to know how you're going to be maybe handing people off, for dental care, possibly triaging them. So I've been teaching people on what I call 8 different applications of teledentistry. And so we're going to focus on 3 of them today, briefly. And so the 2 main things, that you guys I'm sure have gone into is synchronous and asynchronous. Most dentists that I'm talking to want to do synchronous teledentistry. That's just the logical first step. But what I try to convince them to do is that they could see more people, and it's not sustainable probably for them to be sitting around waiting for a Zoom call as they start to do more treatment. And so most teledentistry is done asynchronously, both before COVID and probably as we move forward, people are going to be moving into more asynchronous teledentistry. So a little bit of policy and regulation. If you have a dentist colleague that you talk to or want to explain that you would love to hand off a patient virtually to them, I'd encourage you to point them to the ADA. The ADA has endorsed teledentistry. They have policies on teledentistry. They could go to their website and get these forms. I worked with the American Dental Association and Dr. Glassman, another prominent teledentistry advocate, and we developed some documents for the American Dental Association. And so this is available. A lot of it you don't even need to be a member to access, including some webinars. They also, most of your if you talk to a dentist and you're trying to say, hey, I'd love to be able to hand my patient off virtually to them, and if they look at you sideways, then just tell them that the ADA has this great guidance that tells you exactly almost how to do it. They tell you how to bill for it. And they have a wonderful document that includes consent forms and all that kind of stuff. And so great resources at the American Dental Association. In Missouri, teledentistry is a little more widely available because of regulations that have been passed. In Oklahoma and Tennessee, there's a lot of temporary availability in doing teledentistry. So most of the stuff that we talk about is doable. The first part we're going to talk about is a limited evaluation. And so the ADA put out this guideline, and you guys, this might be a good tool to have in your office. It tells you how to triage in a dental emergency. And so the ADA has this available on their COVID website. And it talks about what is an emergency, what is urgent, and what is not urgent. And so this document is wonderful, not just for dentists. And so if you, the main reason that ADA moved really quickly to get private dental or insurance companies to start paying for teledentistry was to keep people at home and flatten the curve and all that stuff. So limited evaluations are exactly that. Doing a video conference with the patient, you can only do so much. And so the real key is to mitigate risk. That's the obvious, well, maybe not obvious to a lot of people, advantage of teledentistry is that the provider can very, very methodically select the cases that they need to do and triage which patients to see while they have limited PPE and they're spacing their appointments out and all this kind of stuff. And so dentists, if you see here, and dental staff are at the highest risk in regard to proximity to the mouth and to patients and how many people they see a day. And more importantly, we produce aerosols almost on everybody. And so that is what puts us at high risk. In the early part of me doing teledentistry, I was doing teledentistry from provider to provider. So my dental hygienist to me, we would do teledentistry. She would intake a patient, she'd capture diagnostic data, and I would do an exam the next day. But my teledentistry platform was not patient facing. So I quickly, in the first week while I was putting things together, I was using apps like Google Voice. I had my friend here, is not a bleaching thing is not an emergency. So that is her showing her bleaching results. But these things were easy to kind of implement with the relaxed HIPAA restrictions. And so to get a patient-facing tool is very easy to get kind of comfortable with it using platforms that you might be familiar with. And so dentists can use these things. Google Voice is a great option, especially because you could sign a BAA with them and with Google, and this is a platform on the patient's end that is a text message, which is very nice. I've evolved my delivery to where patients submit a digital form to me with pre-written questionnaire, and then they send a picture in the form. They can upload a picture. And so I use this platform called FormStack for that, and they send me this questionnaire, and I'm able to look through it. I kind of have a scoring system built into the form, so I can kind of understand who's more urgent than the others. And the patient sends me a picture. So this person has a hole in their molar, wasn't really very painful, and so we were able to get that patient, buy them some time to keep them out of the emergency room, keep them out of pain, and they keep them from even having to go into the oral surgeon. Another option is a lot of offices, medical, dental, optometry have this platform called Weave. So I've been using Weave now, which has been a wonderful tool. It's HIPAA compliant, and it integrates with our our dental records. So with that, we've been able to kind of message there, and all the staff can have access to the messages that way. And it's been a wonderful platform to communicate with the patient securely. What I ended up doing was piecing a bunch of tools together to be able to intake my patient. This might be a little too of a deep dive, but I just wanted to kind of show you that I pulled a bunch of tools together to intake my patient and to do limited evaluations from where I was. And so on my website, I added a button that lets me the patient book a time with me, and then they fill out the consent form, and then they get an instruction on how to use a Zoom. And then that's what a Zoom can look like right there. The other use case for teledentistry, and I'll just briefly go into it, is that you might find dentists, if you refer patients, you might have dentists that will, you might find dentists that use teledentistry to mitigate the risk of exposure. And so what we are doing here is your dentist might not see the patient when you refer them, okay? And so the patients might come in and see the hygienist only because there's limited PPE available, okay? So a lot of dentists are in so much PPE, and they're having to, when they create aerosols, they can't go room to room like they normally would do. And so a lot of doctors are even intaking their patients, and they're not even going to go see their checkup patients, okay? So the checkup patients might be seen with telehealth. And so they're getting seen with telehealth, and they are going to just get compiled for store and forward, and then they're just going to see the patient's records at the end of the day or the next day even. And then from there, they're going to pick the patients that need to be seen the soonest, because I'm not able to see, 20 patients in a day anymore. I have to, at least for the foreseeable future, we have to kind of space out our appointments and have longer appointments, time to, disinfect the rooms. And so you're kind of going to have to be stretching out your availability. So this also aligns with OSHA guidance. So if you separate the team by doing teledentistry for like you have a treatment team and you have an intake team, then half of your team is getting exposure and half of your team is not. So if the health department comes in and does contact tracing and says, who saw, Mr. Johnson the other day, 3 days ago, he is tested COVID positive and he's, we heard he was in here, then only people they were directly in contact may have to, self-quarantine. We have, whenever a patient is intaked through the hygiene department, then they're going to get full sets of x-rays and pictures taken of their mouth. Intraoral pictures sometimes can be taken with a zoomed in camera. So this doctor here in Arizona, Dr. Hall, he takes a quadrant video of the 4 quadrants of the mouth. And so that's also some offices might have a 3D scanner, which is usually used to take digital impressions, and so you can use that tool to capture diagnostic data. And the doctor will do a probing of their periodontal health, as well as doing a tooth chart. And so the odontogram here can be used as a way to indicate suspicious lesions for the doctor to review. And so this is another way of being thorough and documenting from the hygienist to communicate it to the dentist. The other use case for teledentistry, and this is where it kind of comes into medical professionals, is you can create a way to do a digital virtual handoff from provider to provider. And so this one kind of relates to you guys, if you will, in the fact that if you're sending someone, this Eastman Institute of Oral Health has been doing referrals on patients to the pediatric residency for 10 years. And so they have a digital connection to different offices around New York State, and they evaluate patients so that they don't have to travel just to get a consult for sedation and then travel back 200 miles back to their home, and then they come back again 200 miles to get the surgery. And so that's kind of the ability to triage. I do know one health center that was trying to get a nurse practitioner to upload images if they saw something suspicious, and then the dentist would review it, and their staff would contact the patient after they reviewed the picture and the notes. And so it's more than just a referral. You can turn an asynchronous digital form and photographs and even other types of imaging into more than just a referral to the doctor. Like, instead of just writing a letter saying go see your dentist, or someone calling, you could kind of create a digital form that is sent, and then the doctor can use that form to do the teledentistry exam asynchronously. And so one example here is this is a random specialist that I saw that has a digital form. They essentially were doing teledentistry. They didn't really ever consider that that's what it was. And so they had a digital form that was HIPAA compliant in their website that they could load images and do an evaluation. And so a lot of specialists that have this are kind of upgrading to be more available. And so what's nice about that is you just need a central platform or some sort of way to intake the diagnostic data and send it to the dentist or to the specialist. And so that's a system here that can allow the patient and everyone to reduce the amount of PPE, reduce the amount of in human-to-human contact, and just kind of help coordinate the care of the patient virtually without people just going from office to office and potentially exposing themselves and getting out into the public. And so that's kind of what's going on in the world of dentistry, if that helps.
Yes, it certainly does. Thank you so much, Nathan.
Yeah.
Definitely want to answer any questions. The didactic will be in box later. So thank you for that question. Definitely will get you that presentation and also check back on that. Let's see if there are any questions. Joe, do you have any questions in the chat?
The only question that's popped up thus far is asking if the didactic presentation will be available on Box later.
All right, so we're going to give you a couple of minutes maybe to ask those questions. If you are on video and would like to ask a question, please raise your hand and we'll recognize you and you can ask your question live. Don't be shy.
And to answer that question, yes, that presentation should be on Box later.
Cool, thanks. Another question, I could prod a little bit. Is there anybody, especially in Missouri, that would find it useful to be able to like digitally virtually hand off a patient, or has any questions or concerns about if that's even possible? I'd love to hear your thoughts. And also in Missouri, we're actually considering applying for a grant where we can help with that process, especially hospital to dentist office. And if anybody is interested in that information in Missouri, please let us know.
We did have one question come through from Missouri. Please ask what can medical assistants do for doctors in the way that hygienists do for dentists?
I'm going to let the Missouri Telehealth Network speak to that.
Joe, you want to repeat that question again?
Sure. What can medical assistants do for doctors in the way that hygienists do for dentists?
Is there anyone on the hub team that can answer that question? It's a little out of my scope.
This is Rachel. I thought maybe Dr. Voran could answer that a little bit.
Sure. Let me jump in here. I'm on two screens because we're doing some sharing right now as we speak. Our medical assistants in the last week have been setting up the Zoom meetings for the patients, scheduling the patients in Zoom so that the providers or the residents can see the patient. So they're actually initiating the visit and also collecting many of the information that the provider wouldn't collect. In addition, one of the things that we're also doing is then when the resident needs to check out that patient with an attending, the resident can just invite the attending to the visit. So that's what I'm doing right now, being the attending in the clinic right now. And so when the resident is finished seeing the patient and needs me to see the patient with them, they just add me to the visit. And therefore, the three of us can then communicate back and forth and they can check out the patient for me. That would be the same process that we would take if we wanted to consult, say, with a dentist. The problem that I see is logistics. It's extremely difficult and you have to have some coordination and dedicated time to bring even an attending in, because we're supervising 4 different residents. So there could be 4 video conferencing going on and you're asked to participate in multiple meetings at a time. That's not something that Zoom is easy to do. So we have multiple devices sometimes. And that way we can choose which device to log in to which meeting, but it would be nice. There is a way, but I haven't explored it, to have a multiple concurrent sessions of Zoom running. So that's a problem. But the main thing is with specialists is their hours rarely coincide with the hours that that's convenient for both the primary care physician and the resident. So that logistics issue has to be figured out one way or another. I don't know if anybody has any solutions to that, whether, say, a dentist or cardiologist would be willing to sit around and free up half their day just to be available for potential calls. Most of them, well, they're busy. They want an exact time and a date. And to schedule that party with the patient's visit isn't exactly possible, because most of the time the problems that require the consultation are those that come up in the meeting itself, impromptu. So ad hoc consultations is something that I don't think we in medicine are designed well for.
And that's why I think that dentistry and dermatology are very well positioned to handle asynchronous visits. And so if you have to have a willing specialist, dentist, and that is the problem usually, is because, but you could see like there was 1 in 4 dentists now doing this, and that was not the case 6 weeks ago. And so you might be able to find somebody who could handle these, and you just tell the patient, we'll send right now before COVID, I would guess if you saw a dental infection, give them an antibiotic and give them a list of names of dentists to see maybe if they didn't have one. But if there was a dedicated dentist that was willing to take some of the patients, then if they set up a system where they were intaking them, even my staff reviews them to make sure that if I need to engage with the patient, they've at least made sure certain things are kicked off. And so I think if there's a dentist that's willing to sit down and say, I'll take these handoffs from you virtually, but I need this form filled out so that I get criteria that I need, and maybe sometimes that might require someone in the dental office to go and do some little oral health training about what things are. Even I've seen that before, and so that's probably the only way it could kind of work, but it's going to take some people that are thinking differently. And I will tell you that there are a lot of people thinking very differently right now about how they're going to how their workflow is going to be, because it's all changing.
So I have a couple of questions. One of the things when we deal with asynchronous communications is the importance of imaging and the importance of data monitoring and gathering. I know that when I go to the dentist, they have all this really nice, fancy cameras that you can insert into the mouth and a few other things like that. Would there be a list of tools that primary care physician could be armed with, so that if they were going to do this, it's something they could do real quick and capture the image? Or is that stuff too expensive and too specialized? I know we carry around dermoscopy devices, so it's very easy for us to capture an image, a magnified image of a lesion for dermatology consults, but I can't use that equipment that's designed for the skin for stuff in the mouth or in the ear or the nose for an ENT type person.
Yeah,
and yet,
yeah. I'm not sure what the price is on the medical. So if you have like telemedicine equipment, I do know that some of those companies that have telemedicine carts and tools, they have intraoral tools, and then I do know that if I was going to start doing this with my primary care physicians around my office, I'd probably pay for a low-cost camera. So like some of these cameras are $200. Some of them are $3,000. And so that picture of the zoomed in picture of the teeth, that camera is $200. That's really cheap. And so there are some kind of cost-effective ways to do it. But I don't know if there's any list. But if you have a telemedicine cart because you send images to other specialists, you might find, especially if there's one that takes pictures of the throat, then those might suffice. I've heard them say they double as that when I've asked them at conferences.
Yeah, we're early on in this whole process, and so none of our devices are telemedicine carts per se. I mean, we've evolved over the last 3 weeks from using personal devices like iPads and phones to equipping our desktops with reasonable cameras. And now we're finding out that as our volumes increase, the space within the clinic isn't designed to maintain social distancing between providers. So we're now migrating and upfitting individual exam rooms so a provider can be in an exam room. And of course, we realize none of the exam rooms have telephones and everything else. So it wouldn't surprise me that within a few weeks, if this persists, that we dedicate these exam rooms and start putting more reasonable multimedia type resources in those exam rooms and getting rid of the exam tables and spending the $3,000 or $4,000 that we spend on an exam table on $3,000 or $4,000 worth of televideo equipment in the exam room.
Yeah, and these cameras that I said that are like $200, like they just plug into a USB port and take a picture. It's pretty easy. So they probably work with most imaging. Like if you have a platform, I would guess work because they can be like they have like a Twain driver. If you get technical about it.
Yeah, the dermoscopy devices all hook to our phones. And so our phones have applications on them that capture the image directly into the EMR. So, but those are $1,500.
Yeah.
Excellent. Well, thank you so much. Apparently, we've got some more questions that are coming in that need to be answered. So, Joe, what do we have?
Sure. Next question is there an opportunity to use teledentistry during an EPSDT with Head Start children? If so, please provide resources.
Yeah, so I'm not sure what state you're in, but I would contact your Office of Dental Health in Missouri or similar office in the other state. But
it is a Missouri question.
Yeah, then I would talk to Dr. Dane. He would love that conversation. He and I would probably put our heads together with you, most likely. But as far as the WIC clinics go, there are some logistics. Like back before COVID, we tried that kind of thing, and it was like more people came through than could go through and get a picture taken and through telemedicine because like the volume of WIC clinic. And so we only saw people with problems, like we had a hygienist co-located in there. But there's definitely an opportunity to discuss because just like the dental office being lower, like having social distancing and having a different flow, there might be new opportunities to think differently.
Thank you for that. All right, Joe.
Next question out of Kansas. Is there any reason to use telehealth for routine checkups? It would seem that unnecessary exposure of dental assistants to put a camera in a patient's mouth is a risk.
Yeah, so some dentists are ready to get back to work. And right now, routine dental care is not recommended. So we are advised to just do urgent and emergent care still. And so how it works right now is the people that are trying to do dental intake, like I talked about, those are people who have problems that need an x-ray. They can't just Zoom with me to figure out the problem. Like we actually need to find pathology and make a definitive diagnosis. However, you can do that procedure with a face shield and a level 3 mask, while N95s we can't really get. And so while the doctor's in there with their N95 doing treatment, in my office, we're completely separating the teams. So the dentist is there for treatment only. And so they're not even coming in contact with certain patients until they're ready for treatment. And so that is probably a short-term solution. Hopefully that is a short-term solution. But it is just a risk mitigation. And yeah, the team would have to get exposed to that person, but the goal is to get a definitive diagnosis before the doctor, because sometimes I might that patient could come in and see me, and I can't even do anything. Well, I could root that out before I even see them in person. And so that's where it kind of, and that wouldn't be a dental assistant. It's definitely in Missouri. It has to be a dental hygienist to take that picture. Unless the dentist is in the building. If the dentist is in the building, an assistant can take those pictures.
Thank you, Nathan. Great question. Joe?
Do you have guidance about teledentistry in school settings?
Yeah, that is how teledentistry got its start in California. They've been doing it for over 10 years, going to WIC in schools. And that's how we did the first pilot in Missouri at my health center. We got the Missouri Foundation for Health grant, and we paid for us to go to 33 schools, 1 nursing home, and we had a hygienist in our 2 medical offices. And so we used teledentistry to intake over 1,200 patients that year using teledentistry. And so that's how, but there's going to be a lot of concern right now about even doing healthcare portably in a school, probably. That's maybe not with teledentistry visits, but with treatment, it's going to possibly be a problem for the short term, near term. But it works amazing in schools. Teledentistry works beautiful for children, and it works beautiful for stable patients and recall. So stable patients that just need a checkup, they work great for, and children. And then it also works nicely for nursing home, because it's hard to get a dentist to go to a nursing home.
Absolutely. Great use for teledentistry in those places. So thank you. Joe, do we have any more questions?
We do have a couple. What do we need to look for in camera specs to get adequate images of mouth and pharynx as discussed?
Yeah, so I don't have the pixel amount, but I could tell you that a smartphone, if you could have a dedicated smartphone that's not someone's personal phone, those cameras are phenomenal. And there are add-ons that you can add to to light up the mouth, and they work great. So there's rings that can snap onto the back of them, and they work great because they could sync to the network, and just instead of having if you can't you don't have a cord that way. So those are great if you can have an app that syncs them into a secure file storage system. That would be a great solution. And they're very common. There's a new product out that, and maybe I can Google it and show you. I just talked to the lady a couple weeks ago, but it's like a tongue depressor that's clear that goes in the mouth and lets you light up the mouth and hold the cheek back and the tongue down and things like that. And it lights the mouth up while it retracts, which is wonderful. And so I could share you a picture of that on the screen, hopefully. And then it actually has an autoscope option as well. It's pretty cool. And that thing was $50, which is very cheap. And then you can get just the clear part that is the retractor comes off, and you can put a new one on. And so that's pretty neat. I haven't seen it in person, but it looked really promising because I've never seen anything below a price point of $100. And so that was the first thing I've seen that was like that. But as far as cameras go, you can't use a regular camera right off the shelf, because in the mouth you can't have auto focusing and auto flash, and so you can't use something like that. You have to get one that's either had all that disabled, which there's a dental company that disables all that and presets the focus and things like that, because a camera that wants to autofocus can never find its focus in the mouth. But I hope that helps.
Yes, good point. And thank you for that information about the less expensive type of light. That sounds very interesting. we're missing some of our telemedicine conferences because we go to the exhibits and we see some of that new technology that's come out, and you know people are really ramping up the new technology during this age. I'm excited to be able to see some of that at some point. So, Joe, do we have any more questions?
We do. I certainly want to make sure that folks have seen the comment from David Voren, piggybacking on some of the things that Nathan was saying about the smartphones. I'll read it out for those who can't see the chat. He says, I agree with the smartphones. The problem is that the cameras keep changing on the phones. So an attachment that worked with, say, an iPhone XS will not necessarily work with an iPhone 11, and certainly not with the next generation. We've had to keep our old 6S around because of the ear scope and other devices that were designed for single lens phones. So
I got this product here that I could show. I have no financial interest, just to give you guys a disclaimer. But here's that one that is new. I think you can order through Henry Schein, actually. Is that cool, Rachel? You want me to show it to people? Is that cool? Okay, cool. It's from this company, Holland Healthcare. Let's see. Can you see that? Let's see here. I'll just go to the juicy part. So that's the tongue depressor on the phone, and it just 3M sticks to it. And so that's pretty nice when it can do that, I think. And so there's the otoscope on the one side, and that's the tongue depressor one. And it has this like white thing that has the light, like the battery. And then the plastic otoscope and the retractor kind of go, you just throw them away. And so she's hoping that people will, there's the otoscope. It's pretty cool looking, isn't it? And so it just uses the regular camera of the phone and just, and then I think there's a free app that you can get. And then, what else did they say about it? It was they're hoping that people like a millennial mom will buy it and have it just to talk with their doctor over it, and have it in their medicine cabinet, and it's got to be in that price range. I think that's the closest I've seen to a price range that like a mom of 3 might want to pick up and have in their cabinet. But, I think pediatrics might find this fairly useful going forward, this kind of thing. But anyways, I thought that was interesting. She won Shark Tank in Australia, which is kind of cool.
Yes, very good. And that price point is a lot less expensive than the Best Buy TytoCare that might be out there. I think the last time I looked, it was $199. So yeah, $50, I think people would grab that up. Excellent. Thank you for sharing that. Joe.
Yes, one more question. Is there a list of participating dentists that you're aware of, Nathan?
No. If you contact, like, I'm throwing Dr. Dane on the bus, but call Dr. Dane or send him an email, the state dental director. His staff is kind of keeping tabs on stuff. And you can email me if you're in Missouri and you can tell me where you are, I could try to tell you. But when I started doing it, I had 2 people book an appointment with me from New York City. It was insane. And so, and a lot of my patients in Missouri, I took my ad down because I couldn't predict where they were coming from. So I would say that I was doing some in North City, and so that's like 45-hour drive. But a lot of the places were just completely closed, and most of my patients were new, honestly. I mean, it's not until recently, like this week or last week, did more of my existing patients use it. So that was interesting. But I mean, if you have somebody that needs something, if you're in Missouri, I could see them. That is also a possibility. I can see anybody anywhere in Missouri. I just can't do follow-up care if they're outside of an hour away. But my staff will help them find somebody.
Excellent. Yes, that's very helpful. Thank you. All right. Joe, was that our last question?
We had one more come in.
Okay.
Not necessarily a teledental question, but how does one conduct a lead poisoning test virtually? Doesn't any type of needle stick or puncture require the expertise of an RN? So a parent wouldn't be able to do that in the absence of an on-site RN, right?
I'm going to hand that over to the hub team.
Dr. Wilms or Dr. Warren, would you like to answer that question?
I don't really have any input. I don't know if I'm understanding the question correctly. I do have, and I usually have access to nurses. So if we need a venipuncture or a needle stick, there, and we do all the screening, we do that. So I don't have any, I guess, information on if that's not available.
Well, to me, that sounds like a business opportunity.
There you go. Somebody will come up with something eventually, right? Well, and as we know, telemedicine isn't for everything under the sun. There are things that we can do with telemedicine, and there are things that we must, refer to labs and that type of thing. So we will, we'll keep up with some of these things and go. And I really appreciate the, sharing that Nathan did today. That's excellent information. We know that some people say, what? Teledentistry, they've never heard of it. But it really is the answer to some of the solutions for our rural friends that, just there aren't that many dentists around. So thank you for that, Nathan. We really appreciate your presentation. Please know that presentation again will be inboxed so that you can review that or share that information with colleagues. Joe, are we finished with the questions? Okay, good, very good. I just want to let you know that next week, now remember, no Wednesday tele-echo, but next week, Tuesday, we would like to explore substance abuse treatment via televideo. Of course, that is something, treatment is something that continues no matter what time of year, whether there's a pandemic or not. And we have a lot of treatment people out there doing some fantastic work with groups, with individual therapy for substance use. And so we'd like to introduce that to you next week. And with that being said, we're going to give you a little bit back of your time so that you can prepare for your next meeting. So have a great Tuesday, and we will see you next week. Thank you.